Good. Are we on?
We are on, and we have about 11 people connected. 12 people, they're piling in.
Well, that's good. That's good. Well, welcome everybody to this edition of Arizona Community Grand Round. And at the outset, I will start off for those of you that have a keen eye and discernment. You'll realize very quickly that I am not Mark Carroll, and I'm John Perez, and I'm the Chief Operating Officer for the NARVA Institute, and I'm covering for Mark today. He is involved in a series of meetings and couldn't get out of them, but I also think after over a year of pretty much single-handedly managing the grand rounds, he can take the day. And we've got 12:01 here, and I know that we've got a lot of information to go through. I am going to leave a couple of minutes here for others to join before we get started. I'm very privileged to be able to introduce Dr. Adelsheim. We will get to that in a minute. But in terms of the presentation itself, it is being recorded, so that you will know that, and it will be available on our websites after it gets processed. A couple of other things in terms of questions: use the question and answer box, and it's Steve's preference that if you have a question that comes up, please don't hesitate to ask it. We will try to fit it in as he is presenting, as opposed to waiting until the end. And that's to hopefully be able to create more dialogue than it will be pure lecture. And the final piece is, if there are any questions about any of this that may or may not be addressed during this hour, we're more than happy to be able to forward questions, circle back, and do what we can to make sure that you get an appreciation for not only Steve's work, but some of the very important pieces that are developing right now in the field. So I think that I probably talked right through that couple of minutes, didn't I? Let us get started then. And again, let's get this set up. So I'm John Perez, and for those of you that don't know me, I'm a clinical psychologist by training, and adolescent psychologist specifically. And currently, I'm the Chief Operating Officer with the NARVA Institute. And it is really a sincere pleasure to be able to introduce you to Dr. Steve Adelsheim. I'm gonna read some of his qualifications, experience, and current work status. But I also need you to know that Steve and I have known each other for countless years, a decade or a couple or three. So I will have a few other things to say to set this up for you. But by way of formal introduction, Dr. Adelsheim is a clinical professor and associate chair for community engagement at Stanford Psychiatry, directing the Center for Youth Mental Health and Wellbeing. His work focuses on early detection intervention programs for young people, and he leads the effort to bring ALCOVE to the US, an integrated youth mental health model opening in 2021. And just parenthetically, he's been working on this for several years, and what he's talking about 2021, he'll get to it, is actually the state of California endorsing and resourcing the model. It's one of the more important ones that I hope we may be able to bring to Arizona. And finally, he also leads PEPNet, which is the National Clinical Network for Early Psychosis. He works with youth suicide prevention, tribal mental health policy, and telehealth, which brings me to our first connection, which goes back, I want to say 25 years, something like that, when telehealth was young. and Steve was at the University of New Mexico, and I was in DC with the Indian Health Service, behavioral health, and we were putting together programs that aligned with each other. He was working up into the reservation areas of New Mexico, into the pueblos and up on the nation. And that's where we first met. And we have had ongoing connections back and forth all the way through until my retirement from federal service, which was 2 years ago. And then all of a sudden, we've got other things that we can do together. And we will. So we'll be getting in trouble. So watch the police blotter. And with that, allow me to take a step back, Steve. You have the floor, you have the screen, and it's a pleasure to have you here.
Thank you, John, and thank you, Erica and Jacqueline as well. I'm grateful to be able to be here with all of you. I'm Steve Adelsheim. I use he, him pronouns, and I'm going to share my screen with everybody. So let me get organized around that. Hoping folks can see my screen now. And so I'm really grateful to be with everybody today. And as John said, I'm a clinical professor at the Stanford Department of Psychiatry. I have been here now for coming up on 8 years, but I spent 28 years actually at the University of New Mexico. I did my psychiatry and child psychiatry training there, spent many years doing school mental health work and telehealth development with tribal partners, as well as Indian Health Service. And we'll talk a little bit about some of the other programs that we've been involved in, and certainly during this time, sort of the need to continue to expand mental health support. But it's great to be with all of you at lunchtime, and thanks for taking your lunchtime to visit with us today. And as John said, if questions come up, please feel free to throw them in the Q&A piece, and we'll try to respond to them directly as well as we can. So thank you again. Let me see if I can get to, there we go. So just some reminders about why sort of youth mental health was even so important before we reached this pandemic period. People are very good now at quoting the statistic, half of all lifetime cases of mental illness start by the age of 14. But I think we don't often stop and think about what that really means. And if we think about young people really being symptomatic very early with anxiety or with depression or trauma and having very early symptoms, and that this is starting for half the people really, at least in this country, at that age or earlier, and we think about what systems do we have in place to support people, there's really very little. And when we look at the other data that says 79% do not access care, that's the 1 in 5 young people that may have a mental health condition very early, really have difficulty accessing support. And when we look at this graph over here, which is put together by our colleagues in Australia, one of the things that's really striking is that when you look at the overall morbidity or diseases that young people face between the ages of 10 and 30, most of them are mental health related kinds of challenges. And so, adolescents are generally otherwise physically healthy for the most part, but that's when most mental health conditions really then also have their onset. So it's a really critical time. And as you all know and have seen where you are, we in this country aren't doing a great job in terms of providing early support for people with mental health issues. And again, this is data from before the pandemic, the increases we're seeing nationally in depression, and then the issues around continuing to build access to care. Our national suicide rates have continued to go up, and we'll speak a minute about what's changed in terms of those since COVID as well. But even when I went and looked at, well, why does the state of Nevada have a 1% decrease when every other state was having an increase? It turned out for adolescents with suicide risk and rates, they were still high too. And so, this has been an ongoing issue that we haven't done well in terms of addressing overall. This is a graph that may look a little bit complicated, but basically what we're looking at here is sort of a number of weeks over the course of last year when young people, 12 to 17, were coming into emergency departments. And one of the things that really was striking was these were the numbers that were coming in for mental health related visits. And you see during the pandemic year, the large increase in the numbers of young people coming into emergency rooms for mental health related kinds of problems. And this data that just came out from the Center for Disease Control within the last week or so really also highlights, and this is sort of where, you look at these graphs in terms of young people coming into emergency rooms for suicide attempts. And again, this is over the course of last year. But then as you start looking at this year in 2021, over the course of the winter and the spring, the numbers of particularly of young women coming in for suicide attempts to emergency rooms increased really by 50% over the period, for this period between February and March. And we're seeing many, many young people continuing to struggle even more now with mental health challenges. And all this to say that when we're looking at, what kind of support systems do we have in place, they're usually emergencies. We have systems that support young people when there's a crisis, or when there's a suicide attempt, or when there's a drug overdose. But for the most part, we don't have systems that really allow for young people to get the early support that they need in many, many situations. And finally, we're starting to see a response to that, but it's really been a challenge. This slide really just shows some of the quotes from some of the young people we've been working with, in the areas that I've been involved with, and in the Bay Area, but also throughout California as well. And, when we asked young people around how they were feeling, the things that were really clear was that there's a lot of grief for our young people in terms of a sense of loss, whether it's from graduations or proms or losses really of family members who maybe have died by COVID, and families really dealing with economic challenges and other challenges related to jobs and work that have really upended our communities in really major ways. And what our young people kept asking for was for us to keep checking in with them, regardless of whether we even responded or not. But we really, they really want people to listen, and people who are willing to keep coming back and asking how they're doing, even if they maybe don't want to give an answer. And the other issue that's really been challenging for people is creating opportunities sort of for spontaneous communication and check-in in a way that they're used to be in the hallways at school or in its settings or doing sports. And now as we're starting to see the reemergence of all those activities, it's terrific, but it's still really confusing. And this is also an age group that maybe are less likely so far to have been vaccinated if families are supportive of that. So then the questions of how we address those issues and being close together in physical situations or coming together continue to be at times confusing or challenging. We've continued to look as a program at, the different things young people say in terms of linking to mental health supports. And some of this data really came about before the pandemic, but some of the things that were really striking were that, whether young people are dealing with a very high-powered, highly competitive school setting, or one where really they're dealing with issues in terms of social determinants of health, where there are a lot of economic challenges and poverty challenges and struggles around accessing basic supports. There's lots of stresses that our young people are feeling across all of those settings and situations. And sometimes it just feels like it's too much to deal with. At the same time, the idea of going out and getting help on your own presents a lot of great challenges. For many young people from many families, there are major cultural issues and stigma that might impact the comfort level of a young person and asking for help. For many young people, it still feels like a failure to go out and ask for some type of support. And then there's a sense that when young people do take the risk or the leap, sometimes it feels like the people that they're turning to, aren't really listening or don't really care. And just have sort of a pat answer about what they need to be doing in order to feel better. So those are challenges our young people are seeing. When we turn to school, and this is a slide we used for many years in the New Mexico School Mental Health Initiative, and with our school-based health center partners, we see our young people in class dealing with multiple health and mental health and social challenges, whether it's stoned, depressed, no father, homeless, pregnant, working late shift, dealing with your kids, in front of a teacher who's dealing with their own family challenges as well and their own struggles, makes it really hard to feel like everybody's going to be learning everything they need to learn, especially right now when we're all walking in back to school, whether dealing with or bringing our mental health challenges as a student, or maybe as a teacher or a school administrator. We're all facing lots of challenges, balancing our own family situations as we come out of our homes and try to figure out how to take care of ourselves and our families at a really complicated time. One of the things that we're seeing right now is increasing attention on then schools as a place to bring back support for young people. And we're seeing more resources come to the table, but there's some challenges I think we're all going to be seeing, which is that many students will be coming back to school with much bigger sense of struggles around anxiety, around depression, around these losses. One of the questions that many schools are struggling with is, how do we identify these young people? Should we be building in screening models or screening processes into our school settings for mental health issues? And some have done that for a long time. Others feel like for purposes of stigma, that's not something they should be asking about, or parents maybe don't want schools to be getting involved in the mental health business. And so there are lots of issues around that as well. In addition, there may be more people that will be identified as having a disability and may need additional supports, whether it's through Section 504 or special education or IDA services. And schools really don't at this point have the systems in place to really ramp up those kinds of supports. We see many schools, at least where I am so far, where the dollars are leading to more counselors coming into schools and more providers coming into schools. But with that, there are huge and complicated needs around where is everybody going to fit? How are we going to make these referrals happen? What's the system going to be for identifying who gets referred to who? And they're all sort of complicated questions. And then for our school staff, they're going to be coming back into settings where that's going to be increasingly stressful. Many of our teachers and staff are coming in with their own health and mental health challenges, concerns about their own family as they return. So there's a lot of support that's going to need to happen. One of the things that we're also seeing, though, as we said, is that there's a lot more dollars on the table for school mental health, and in fact, more than we've ever seen before. And I just looked a little bit at some of the funding coming out through the state of Arizona, where the school safety program that's really a couple of years old has been adding more counselors and social workers, and now have an additional supplement to bring even more to the table. And so the question is, how will those happen? And on the federal level, billions of dollars are going to come to schools all over the country to help broaden support around whether it's linkages for teacher support, school support for students, even broadband in some situations where there's been difficulty making connectivity happen. And then Project Aware, which many states have received funding for, to build out support and mental health in schools and training in mental health first aid. There's a whole other set of money for those programs. Excuse me. As I mentioned before, I've been involved for many years in looking at school-based health centers as a model and looking at ways of creating community spaces on sites for young people to come in and get early care that often integrate both primary care and mental health. And often the reason for doing that was for many young people and families, it was too stigmatizing to go into the mental health clinic in a school. But if you also had the primary care providers, some young people are more comfortable coming in and talking about their stomach ache or their headache or that issue first. And then often by the second or third visit, you get to the underlying mental health issue and can kind of do a warm handoff up to the mental health person across the hall. And those are often more comfortable ways for providing support for young people. Where I came from in New Mexico, we had a major investment all over rural New Mexico in building out school-based health centers as the place for young people to come in for early care. And that plan continues to this day. We build in screening programs and models for school-based health centers with regional infrastructure from the state that supported all of the different regions to be able to have both school health and school mental health advocates from the state team who could help coordinate and link those services. And we don't want schools to have to do this work alone. So really looking at these linkages between school districts and community partners in terms of linking services becomes really important. And as schools maybe, identify young people in the highest tiers of need for more intensive clinical intervention, those can often be the places where the community partners can also provide additional support and build those linkages and intervention as well. One of the programs that we have, worked with actually at Stanford that started in the School of Education, and we have a lot of partnership with, is Challenge Success, which is a program that also has really taken on a lot of school districts, and there's been a lot of national interest because they're really trying to reframe ideas of success within high schools. And that for many of the high schools, certainly where I sit in the Bay Area, the goal is, you have to get into the best school or the best college, and really there's so much intensity and competition. There's really been a great need to reframe what success looks like. And within that framework, really, Challenge Success has worked with programs to sort of shift the narrative around what success really looks like for young people and their families in a way that's been really important. As we look at some of these challenges, as young people are coming back, part of the issue becomes how do we build these community supports and school supports? And as I mentioned, many of the young people that we work with are facing real loss of sense of control, lots of fears about what the world has become, and a sense that the world has become smaller for them, and stressed about what does it mean to come back out in a bigger way. Changes in terms of even time for young people has been really a challenge as well. So, some of the things we've really been looking at is what have been ways right now that we can be building opportunities for peer support and connection. Many of the young people we work with, and I'll talk in a few minutes about our youth advisory groups, have really focused on looking at the use of social media, but in positive ways, and looking at ways of building out, again, even broader ways of connecting with each other. For many of them, it's involved also creativity and looking at art-related activities. But even within schools, how does one use a school environment to be able to link people together and build broader senses of connection? So we've been working with other youth groups from other communities, whether across the state or even working internationally, to start building youth connections around broader support and broader guidance between different groups as well. In addition, part of the issue becomes, what are some of the other strategies that we can help give young people around self-regulation and an ability to feel more in control and also feel more able to manage their own situation and the things that they've been dealing with. And so, you know, some of the things that people have been recommended, and you'll see these in lots of different articles and different presentations right now, but the importance of being able to manage stress through physical activity and finding physical outlets right now, looking at ways of structuring one's time to have a better sense of both control, but management of that. Mindfulness has become really important for many people to be able to learn how to deal with their stressful thoughts and stressful feelings. Sleep has really become a challenge for many people right now without having to always get up for something at a regular time. So creating a consistent schedule. As we mentioned earlier, the need to check in frequently with young people becomes really important, and having structures to be able to do that. And, you know, this last bullet, one of the things that, you know, that I find myself talking to lots of families about is this whole issue of stigma, really, and the fact that, you know, we all come from families with family members dealing with mental health issues, and they're present in all of our families, but we often don't want to talk about it. And so I often feel like at this time it becomes important that we as family members work to break down that stigma and be able to acknowledge to our own children our own challenges, our own sense of loss, the struggles that we've experienced within our own families, and to really normalize all of those issues so our young people don't feel that there's something different or wrong, or that they have to keep those feelings secret, to allow for those conversations, for us as parents to share our times of failure so our kids don't feel pressure that they don't need to be feeling as well. So being able to have those open conversations seem really important too. I just listed
Dr.
here a
Adelsheim?
couple. Oh yeah, hi.
Hi, sorry, I have a question that's related
Absolutely.
to supports. So you talked about the unique circumstances relating to COVID, and I wanted to ask you a question about how do we incorporate the natural supports into our system that's currently here in Flagstaff? You talked about the family and how we can provide supports. You talked about, you know, supports in the school, but I really wanted to touch base on how we as professionals, social workers, mental health providers can incorporate those natural supports.
So I think part of what becomes important, I think, is, well, I think there are a number of opportunities. One is, I think, being able to have conversations with parents and families around these issues and sharing with them, I think, your perspective, whatever it might be, around how to maybe sort of address some of these challenges with their children. And maybe it means working with your families to suggest to them, even creating some time within the context of the home to be able to have these conversations, or specific family activities that might be, you know, important moments to be able to have some of those dialogues and do some of that sharing. I also think group processes for young people can be really helpful right now, and especially when school may not be happening. You know, whether they are with groups within therapeutic situations or other types of situations, being able to have those conversations, I think can become really important as well. So, so I think that becomes another way in which support becomes really important. I think, you know, depending upon the cultural group that you're from, I know that as we've been working with many Native American partners and communities, this also becomes a time when reaching out in terms of family tradition, connecting with elders in the community, and being able to embrace some of the other spiritual supports within the community and families also becomes particularly important. And having more available opportunities to make those connections and have those conversations and experiences also become really important in terms of identity development, identity support. I think all of those can become really critical and helpful as well. I don't know if that helps.
Thank you. Yes, it helps greatly. Thank you.
Sure. So I was just going to share, some of these resources, you may not realize it, but there is this whole network funded by SAMHSA, which is the the Substance Use and Mental Health Services Administration from the federal government, and they fund a regional network of support that includes Arizona, and has been doing a lot of work focused on schools and school mental health and training also to support teachers, especially right now in terms of wellness and health, and maybe would give additional strategies as well to answer Jacqueline's question too. And then in addition, the National Center for School Mental Health has been a big partner in this work. And they've been doing a lot of COVID response work and has been a really big partner in working to address some of these issues too. At the same time, as much as we're focusing on schools, there are also school challenges. As I mentioned, I've been working in schools for many, many years. And as we said earlier, there are often these other limitations. There are space issues. There's questions of to what degree health of our students is a school district's responsibility. There's often lots of turnover and lots of challenges in periods of time where school isn't in session. In addition, for young people, there are issues related to school supports around privacy, confidentiality, being able to have conversations without being worried about if the person you're talking to is going to share everything that you share with them with your parents or up the academic system, or think about how that's built in an effective way to the response at the school. And so, part of what we've been looking at is how do we go beyond school mental health, as much as it's critical and important and growing, to look at this whole continuum of early intervention in public mental health, which has led for us to this ALCOVE program, which is an integrated youth mental health model we'll talk about. And I don't know how many of you are even familiar with early psychosis programs, but I want to mention them quickly because right now we all have a role in supporting young people that may have early signs of becoming confused, becoming paranoid, wondering if they're hearing voices, because the interventions are so effective and can have such a positive impact if we can help young people get support early, that those linkages are critical. And we'll talk in a few minutes about the commitment there's been on a national level to build that support as well. But I'm going to talk for a little bit about ALCOVE and the reason for that. And part of it is, how do we have a community place, in addition to schools, for young people to get the support they need in an environment that's supportive and comfortable for them? So as we look at these kinds of models, we're really then targeting, frankly, 12 to 25-year-olds, middle school, really through young adults. And what is, up through 25 is often called the second 0 to 3, because that's when brain development is continuing in an ongoing way, up to the age of 25. And the goal has been to create a community place and a location that's easy for young people, where they can come in easily at free or low cost, so that every young person can be seen. And you see this list of sort of early services that young people could access. And, this is a model that really has been developed with international partners that has now really gone global. And as John was saying, these ALCOVE sites, we're going to be opening the first 2 of these on Friday in Palo Alto and in San Jose. And it's been a long journey to get to this point, but we're all excited and also really anxious about how this is going to go in terms of sort of the setup and the big day. And it's become a very political event in a lot of ways, because we've been working at this, the state and local level, for so long. But, this is also an event that will be led by our young people, because this model is unique and critical because it's very youth-centered, it's youth-informed, and the youth advisory boards have critical roles. And the idea is to create an environment where young people could come in on their own or with a friend and get the early kinds of mental health support that they need. And as you see, they have integrated care with physical health as well as mental health, peer support with young adults who can provide that additional kind of care as well. And then linkages to other higher level, more intensive services as needed. And as you see the last bullet, but branded in a way that identifies them as a specific program for young people. And I'll talk more about that in a minute as well. So some of the principles, as I mentioned, is really the voice of young people, and that the care is really by providers that really are focused on and motivated to work with young people in a real way. And again, trying to follow all the state laws and federal laws to maximize the informed consent and confidentiality for young people as they come into these sites in a really accessible kind of location. The name was developed by a group of young people, both locally, but with others around the country that gave input, really with the idea that everyone can come in, and this notion of this cove as sort of a safe, protective harbor for young people to come in and get the kind of support that they need. As I mentioned, the youth advisory group is critical to this process as well. And really each site has its own youth advisors. We have 15 for the Palo Alto site and 15 for the San Jose site that are meeting regularly, giving guidance around the services and the programs. They're involved in the site selection as well, the design of all the components, and also really represent the program out in the community and have been active in terms of lots of areas around, whether it's talking to county supervisors or legislators or others, and really ensuring that we're very intentional in the support that's being provided, and that the inclusion of young people, even in terms of hiring the staff, has been a critical piece. And I can tell you at a place like Stanford or in Santa Clara County, the idea that we would have young people involved in the job interviews and giving real input into the hiring process is really a shift culturally for these institutions. But it's been a really critical piece of developing this model and this process as well. As you see here, the youth advisors, really also reflect the environment in the community in terms of diversity. The little bear up there is at the California State Legislature, and that's some of our youth advisors with the State Director of the Mental Health Services Commission. And on the left on the top there is the new site in Palo Alto with its old sign, but a number of our youth advisors got to see it and then make decisions about whether or not it would be a good site as well. We've been meeting mostly by Zoom, and some of us are going to really be getting together physically for the first time on Friday at these site openings, and people are pretty excited about that as well. So all of this to say the youth participation has really been critical, and we've really created lots of opportunities for our young people to take the lead, whether it's in talking to journalists or talking to legislators, or they're going to lead the welcoming events on Friday. And so it's been a really important process for all of us. What I will also just tell you is that as we've been building out these sites, as John said, the state of California has made an additional investment in these as a pilot model. So in addition to these 2 sites, we're going to be working this next year with 5 other communities that have been funded by the state to roll out this model as well. So we have these core components that our team will be working with them on implementing from our sort of implementation support network here at our Center for Youth Mental Health and Wellbeing. But as we said, they're all going to have a common look, a common design, common components. They're all rolling out their youth advisory groups now and getting ready to put the services together. We're all going to have a shared minimum data set and common evaluation process so that we can all be collecting good data and see how well these go. At the same time, we want to allow for the uniqueness of each community as we build the sites out. Our colleagues up in British Columbia have sites called Foundry, and as they built them out in some of their more indigenous communities, in created spaces where people could do smudging in the buildings to be able to do that in a way that wasn't going to set off fire alarms and smoke detectors, but really wanted to build out sort of unique components to the services that would meet the culture of different communities. And our hope is to be able to build a common components, but also be able to build in services that will be consistent for young people as they go across the state or across the country to sort of look at this model over time. And as I said, we're working closely with a lot of international partners. The World Economic Forum has gotten very involved in this model and participated in putting out a document about coordinating these services internationally. So we're working closely with all these partners in Australia and Canada and Ireland and elsewhere to be able to sort of build a common network and even looking at common data collection for the services. And as I mentioned, our team is going to be starting a learning community as we roll this out. And frankly, if any of you think about this as an interesting model for your communities, we'd want to be able to include you if you're interested in being part of our national learning community, to be involved in the listserv or the trainings around this model, something you think you might be interested in looking at rolling out over time as well. Here's a slide of the some of the programs in Australia, and I use it to transition to the idea that as much as in Australia, they have a program called Headspace, which is now sort of what Alcove is based on, and they're up to 130 sites across a country, half the population of California. They also really have looked at how to build in these early psychosis models because of the idea that they want to find young people early when they're at risk for having early questions around hearing voices or paranoia or other kinds of psychosis-related kinds of symptoms, to be able to link them to services early. So they're locating and co-locating these programs there. And I just want to share with you, if you haven't heard anything about this early psychosis work, that across the United States, this is now a really big national initiative. And whereas in 2008, there were maybe a few programs in Oregon and in California, there's been a big federal investment in this model, and there's now over 340 early psychosis and first episode programs across the country. And they all sort of have a common model called coordinated specialty care that have sort of a wraparound framework for providing sort of early supports for the person who maybe is developing symptoms and supporting them and their family as well. We run a national network called PepNet for programs that are developing these models, because we really want to help build broad support and clinical networking and training around this. And we're looking at doing our 4th annual early psychosis conference and planning it now with our federal partners. But if you're interested in learning more about that network, you could search for PepNet, and it'll give you the link to our program, and you can join our network and join our listservs. And we're really focused on the clinical needs of these programs across the country. I would also share with you that the National Institute of Mental Health has now rolled out a program called EpiNet, which is an effort to look at coordinating data and research for these programs. And they have funded 8 hub and spoke networks focused on early psychosis. You can see where they're located. Together, they total 102 different clinical programs around the United States. And they're looking at sort of a coordinated model of assessment. But one of the things they've really wanted to do is to make this core assessment battery available to any early psychosis programs around the country that want to become involved in the data collection and look at using these same data tools for their general clinical program related to early psychosis. And so if this is something that's of interest, you can look at EpiNet, and then they have the links to the core assessment battery. And you can look at those tools and see if there might be value in including some of them in the data a site might collect, or as assessment tools that might be helpful for your community as well. And just to give you a sense of the scale of this funding, every state gets money from what's called their mental health block grant from the federal government that goes to each state. And every state has been getting additional 10% of that amount of money for early psychosis programs for the last 4 or 5 years. In addition, as that money's been rolling out, there's been the COVID response money. And within that framework, there's new dollars going to every state for mental health support. And the numbers you see under the first bullet are the numbers coming to Arizona for COVID response. And within that, $2.27 million for early psychosis programs, money for crisis response programs that are going to your state mental health authority. And it's not clear necessarily how those dollars get spent, but it might be worth trying to find out and seeing how that happens. And then as you see, this $2.27 million for early psychosis was also added again twice over for some of the new legislation that's come out in terms of COVID response over the next 4 years. So there's a lot of money coming in your state for these programs that can be lent to some of these upstream services. Sort of all of this to say, our young people really need tremendous amount of supports, and we have lots of opportunities to build these early intervention models. I don't think there's ever been more resource that I can remember coming available for mental health, whether it's school mental health or early psychosis or early intervention in general, because of this pandemic. And it becomes this really critical time that, we can maybe look at building some of these upstream supports in addition to the crisis programs, the inpatient programs, the residential programs. But if we can find ways to support those young people early when they're 14 or younger, or have comfortable places for young people to come in, before things reach a crisis point, hopefully we won't need as many of the high-end services that we're always looking for our youth. So let me just stop there and see if there are any questions or comments or other thoughts folks have. But thank you. What if I stop sharing my screen? Would that be okay? Hi.
Steve, I have a question, please. Regarding the model and the alcove headspace model, and we had some discussions up here in Flagstaff actually a couple of years ago about being able to put something together. And we've got the various kind of building blocks, but it's trying to get the right metaphor, a little glue or cement to try and put the blocks together so that they can sustain. And what you've seen over the past several years as you were developing or really promoting the programs in California and elsewhere, what is it? Were there hooks? Were there things that seemed to help people kind of crystallize and understand what the model was and the power of it? Because I've seen it. I saw it in Technicolor, but for some, it's kind of like, oh yeah, how does this work and what's so different? So I don't know if you have any helpful.
Thanks, John. Yeah, thanks, John. It's a great question. So I think there are a couple of things that really helped here in terms of moving this whole idea along. And I've had I had 2 trips maybe to Flag to meet with people about this model. And one of my favorite times when I was last there was, I think I had a meeting with a group of young people, right? And we sat in a room and talked about what people were needing in terms of additional support, what was working well at schools, what wasn't, and what those supports were. And I will tell you that when I talked with one of our local legislators who sort of bought into this idea early, and I didn't sort of mention to everybody else here, but I think some of as after the year after I moved to Palo Alto, They had their second youth suicide cluster here. And as much as I had done a lot of youth suicide prevention and postvention work in New Mexico, I was right away back into working with schools and working with families around suicide prevention and postvention and trying to work out ways of building support in that area. So, you know, we talked with some of the local legislatures around the needs of the young people in terms of upstream services. One of the things we agreed to early was that if he could create even some early funding for someone who could really be a youth coordinator and help really focus on bringing young people together in a regular and coordinated way, that was a really important piece. It wasn't a position that was fundable through Medicaid. It wasn't going to come through reimbursements. But what became really critical early on was the youth voice. And, you know, it's easier for a legislator or a community member to certainly dismiss, you know, the white psychiatrist, you know, in terms of this is what I think all the kids need, rather than the young people themselves saying, you know, these are the supports we need in our community, and this is what we need for ourselves and our families. And so the youth voice became really critical really early in terms of moving this momentum along. And I would also say that once some of these folks heard from some of the young people, you know, we actually scheduled a trip to, we couldn't quite go to Australia, but I took a couple of people up to Vancouver to see the Foundry sites and to get a feel from there of what was happening in the model. That was a really helpful thing. And some of the people from the state of California came back and said, okay, we get it. We need these in every county in California. How are we going to make that happen? And so that was important. So, you know, you could go to Vancouver, but my hope would be in a couple of months, we will have some really productive sites going in San Jose and Palo Alto, and people could do a field trip and come see us that way. But also, I think as we develop the learning community and allow for the interface with the partners that are rolling out this model, as well as the ones that are farther along, my hope is that that will spark some interest and give people some structure. I will also just say that, you know, in some of the communities we're working with, finding a way to pool resources, even to create like a half-time program coordinator who could really focus on bringing the different networks together to meet on a regular basis, to bring the voice of the young people to the table, to work on this, to link, whether it's a federally qualified health center or, you know, a community mental health agency, and start making those linkages for the continuum services on a regional basis, and look at building the funding streams and networks together becomes really important. But having an identified person who can sort of take the lead on behalf of the community to sort of organize everybody has also, I think, been really helpful.
Yeah, that's terrific. I know we have one question, but just a follow-up on this for Flagstaff. When you were first out and we did have those discussions with the kids, it was Jamie Whelan who was a council person at the time. And we were talking with some of the kids after, and they even named the place. They said it was my place, which is my place to find my place. And the energy behind it was really positive. And then of course, COVID hit and other things. So I don't want to give up on the my place concept. So expect me to come out and see you soon. Maybe.
Well, and I don't want to give up on it either. So expect me to come out and see you. And I think if there are ways to be able to, you know, build support or do whatever I can do to sort of help support making this happen in your communities, I'm glad to do whatever would help.
Okay. I know we have questions.
Erica, what are you thinking?
So many things. I'm so excited. I don't know if you've seen me scribbling down notes, but so thank you very much. I am serving as the program manager for the Stronger as One Coalition, and that our goal, and it really is aspirational for us to be serving in that space, to provide those linkages, to bring people together, and to follow up on that initial presentation, that momentum we had with our young people. We had a youth summit in January of last year.
Wow.
Just before COVID, to continue that conversation. and your message resonated with our young people so much. And so I think that we're in a space of trying to do that preliminary work and prime folks for implementing this, because I think we recognize the need collectively and trying to find that way to continue that momentum and move it forward. So my question for you about all of this is, as we're doing that work and trying to bring in additional organizations and continue fostering this collective to support this work, especially in the light of COVID, have you found anything that's been successful, or have any advice for recognizing, kind of finding the balance between recognizing and honoring that disenfranchised grief that our young people are experiencing, and then also fostering that resilience so that we can recognize the impact of COVID, but continue moving forward to support them?
It's a really good question. We did a series of webinars with this group made of millions that are posted online, and we really wanted the voice of our young people to really be the lead in each one of them. We did 5 of them, and one of the things that was really important was looking at the different cultural groups that were in our community, and really looking at their needs in terms of mental health support in really clear and specific ways. And I think appreciating the ways that different communities grieve collectively and young people sort of independently. And I think part of the issue really has just been to help normalize the grieving process, and also help support families to be able to sit with their young people and be able to tolerate their young people really grieving. Because I think sometimes as parents, and I have 4 kids, and we don't always know how to sit with our kids and allow them to openly struggle. And there's always this sense of we need to fix it right away. There isn't room for that sort of opening. But often, in allowing for our young people to go through those processes is the movement to resilience, as you're talking about. And frankly, for a number of our young people, even doing a lot of artwork was really helpful, both then in terms of expressing the sense of losses, but then utilizing it also to move towards the development of resilience. I think there's just a lot of family education that really needs to happen. And I think right now we're seeing a resurgence of the value, I think, of youth voice. And as we start to talk, whether it's with school personnel or superintendents or others, around no longer assuming what their students need in order to be successful, we're finding that more are listening. And frankly, even seeing our schools now, as schools have struggled to open, and then there's the parents that really want their schools to open right away so their kids can be back in school. And then there are a lot of families that are really fearful about their kids going back in school, or are they going to bring home an illness to the family as well? And those struggles and those tensions are still there in really active ways. Trying to find ways to support the parent voice in interfacing with schools and community, I think, also becomes really important. And so I don't think I directly answered your question, but I do think finding outlets for those processes and normalizing them sort of allows for that resilience to come out. And I think also, the notion that being able to grieve in a safe and comfortable way is a component of resilience, for all of us, and acknowledging just the waves that we can control and allowing for the supports to be available when we're feeling those things, I think, is just really important. There's a question in the chat. Huh? Oh,
Yeah, we have a couple questions, actually. One is from...
For everybody out there, we're coming up on the top of the hour. I am certainly willing to let us go a little bit further down the road here. We've got 2 questions left that I see. If you're willing to stay, please do. If not, thank you very much for joining us. And Jen, it's to you.
So the two questions are really good ones. First, we have Nancy Rowe's question of, do you find that telehealth in schools work for counseling and or peer support groups for young people?
So, I will tell you that, when we were looking at starting a lot of our telehealth programs, we came to NARBA and came to learn from all of you in your community around, around services before going back and starting a lot of our telebehavioral health programs in New Mexico. And, I started working, actually doing telebehavioral health with some tribal partners, and then started doing links, three-way connections to the school so that we could be meeting with the student and the staff and maybe a special ed teacher with the family and the therapists, and really found that those models were really quite effective and valuable. And so I would say, yes, the linkages in schools are really critical. And also, my colleagues at the University of New Mexico, I think, are still doing a model that's like a Project Echo model of support for school health and mental health providers. We just started our first Native American Youth Mental Health Project Echo last Thursday that we're doing with California IHS. And, we were hoping for 50 people. We had 125 show up for the first one. And we also really wanted school partners to be able to be there, because I think being able to have ways of providing support to school health professionals and school staff is really critical. And I think, frankly, telehealth can be a really valuable model. And I know for the years I've been doing it, I think there are ways to do it well, and I think it can be incredibly useful. So yes.
I'm the telemedicine manager for Health Choice. So,
right.
And Nancy actually was the director for the NARBA's program. So
Well, thank you again, Nancy.
We might be partial. We currently have early psychosis interventions Project Echo out of Health Choice, Arizona.
That's
if anyone's interested, just let me know. Dr. Jelliff has a question. We have so much trouble getting kids into inpatient units within Arizona with serious symptoms. Out-of-state behavioral hospitals reject them often too. This is getting worse. Do you have any ideas of why and how to improve the competence of inpatient units and residential units to address the serious behavioral health needs of children and teens?
Thanks, Amy. Well, I obviously don't have easy answers to this question. What I can tell you is that certainly we are struggling still with access to these services. I mean, I'm in a county now in Santa Clara County of 2 million people, and there really is no adolescent inpatient unit at this point, and the county is getting ready to build one, and Stanford really hasn't been involved in creating its own, but now we're linking to one in a different county where young people are coming in and we're doing that support. But I think part of what's also been hard for us has been our own ability to manage sort of the services. What I can tell you is that when we've now had opportunities to actually be managing more of the beds, for example, if there's this one in San Mateo, which is sort of north of Palo Alto, and have our own team of people, that's been the part that's really sort of worked well. And then staying in really solid communication as people transition out has been really important. I think part of what's been so hard, and I was really running an early psychosis program for a number of years here. And, part of the struggle has also been the turnover was so fast, and the urgency of getting young people stabilized was so problematic that, as much as there's this concept, right, with early psychosis of start low and go slow, there was it's totally counter, right, as you're saying, to sort of the inpatient services. And part of the issue would be these young people would come out of the hospitals totally overloaded on medication that they didn't want to take because of how it made them feel. And we had to really quickly start dialing back medication and find a good balance in things. And so all this to say, I don't have an easy answer for you, but I also think if we were working with some of these providers to be involved in some of your early psychosis, ECHO or, PEPNET on a national level, to be part of the clinical models or on our listserv, I think there's just still a huge education piece that we need to be building out. And I wish I had a better answer for you, but it's good to see your name there. So thanks for reaching out.
Steve, I want to thank you personally, and thank you on behalf of the Institute and for the state. It's we will get you back here. Our work is not yet done. And for all of you out there, I thank you for taking a couple more minutes for us to finish up what I think has been really enlightening and very positive conversation. And I hope that we can take some of the steps that you've already taken to support some of our youth here. So with that, I thank you very much. We will get the recording up on the website as soon as we can. And I thank you all very much. Be safe.
Thank you, everybody. And you're going to keep teaching me too. And I really am grateful for that. So it's great to learn from all of you as well. And thanks for including me today.
Thank you all. Thanks, everybody. And we'll see you next time around.